Hello, this presentation is on simulation basics, and I am Dr. Joanne Farley-Serembis. Simulation has been defined a number of ways, but we're going to take the definition provided by Morton in 1995, which reads that simulation is an attempt to replicate some or nearly all of the essential aspects of a clinical situation so that the situation may be more readily understood and managed when it occurs for real in clinical practice. Simulation mannequins have been a staple of nursing education for more than 100 years. Until the 20th century, though, nurses trained in real time on the battlefield or in rudimentary clinical settings. Then in 1911, the rosy-cheeked Mrs. Chase made her debut. Hartford Hospital approached the Rhode Island doll manufacturer M.J. Chase Company to design the first mannequin tailored for healthcare practice, and you will see Mrs. Chase on the left of the picture. Modeled and named after her creator, Martha Jenks Chase, Mrs. Chase stood 5 foot 4 inches and featured stitched knees, hips, elbows, and shoulders. 3 years later, she acquired an arm injection port and an internal reservoir. She and pediatric simulation baby Chase dolls remained ever present in nursing schools for 6 decades. Specialized mannequins with realistic breathing and heartbeats replaced Mrs. Chase in the 1970s. Computerized, gender-specific simulators that bleed, blink, cry, and react in real time have recently proliferated. Simulation education today appears to work just as well, if not better, than clinical experience, according to a comprehensive National Council of State Boards of Nursing study that followed 666 students at 10 United States pre-licensure programs for 2.5 years. The study, published in the July 2014 Journal of Nursing Regulation, found that students who spent 50% of their time in simulation education scored higher than a control group on assessments of mental health, medical surgical, maternal newborn, and community health nursing. Now, you had a couple of chapters to read from the Jeffries simulation book. Jeffries in 2005 developed the Nursing Education Simulation Framework. It was developed and initially tested along with the National League for Nursing and the Laerdal Simulation Study. The framework was developed based on insights that were gained from theoretical and empirical literature related to simulations in nursing, medicine, and other healthcare and non-healthcare disciplines. The Nursing Education Simulation Framework has 5 conceptual components, each of which is operationalized through a number of variables. The 5 concepts include: first, teacher factors; second, student factors; third, educational practices that need to be incorporated into the instruction; fourth, simulation design characteristics; and finally, expected student outcomes. Now, there are various types of simulation that you will be learning about during our on-campus intensive experience. The task trainer simulation, mannequin-based, standardized patient, virtual simulation, hybrid, and in-situ simulation. But I'm going to review those briefly with you right now. The task trainer simulation allows the student to practice basic skills on lifelike models to ensure patient safety and comfort. Most task trainers are lifelike models of body parts, such as an arm or pelvis, as you see here. Mannequin-based simulation allows students to practice and fine-tune procedures using life-size patient models that breathe, have a pulse and a heartbeat, and show true-to-life vital signs. This simulated patient can be programmed to display a variety of medical emergencies such as a heart attack or a stroke. The standardized patient simulation is something that was borrowed from medical students. They would use this at the end of their schooling in order to take an in-person test. And so the standardized patient simulation facilitates interactive teaching through the innovative combination of technology and patient actors. The patient actors are called standardized patients, and the standardized patients have a depth of experience in acting. They're given a transcript of what they're supposed to say to the student as they come in. A lot of times what they do is they act out a particular disease condition. Now, virtual simulations are also very useful. They are computer-based, adaptive, interactive simulation with an integrated curriculum, resources, and personalized feedback, and they provide with that a full simulation learning experience for every student to promote confidence and competence in patient-centered care. These are actually done on a computer, and they simulate a number of different assessment issues, problems that the student can learn from. Examples produced by vSim, CliniSpace, and Neighborhood 2.0 are just some of the ones that you will see. The hybrid simulation allows students to practice complex skills and therapeutic communication simultaneously. Emergencies that require manual and verbal skills can be trained with hybrid simulation. Probably the one that's the most commonly used is having a human being, as you see here, who is actually simulating giving birth, but at the bottom of the screen what we're seeing is a model, and we see one that is able to deliver a baby, if you will. And so we can have the woman who is giving verbal feedback during the labor and delivery period, but also we're able to simulate the actual delivering of a baby. Next are in-situ simulations. You see these used in professional nursing development, and what this means is that they take place in the actual work environment. And so the simulation and simulator are brought to the site where the learner is practicing, so that you may take it into an empty room, for instance, to practice mock code or other types of emergencies or skills that you would like the nursing staff on the unit to learn and practice. Simulation fidelity refers to the extent to which a simulation mimics reality. A model for fidelity characterizes it into 3 dimensions of realism: environment, equipment, and psychological fidelity. Now, the environment fidelity is the extent to which the simulator duplicates motion cues, visual cues, and other sensory information from the task environment. Equipment fidelity is the degree to which the simulator duplicates the appearance and the feel of the real system. Psychological fidelity is the perceived reality of the simulation. There are 3 levels of fidelity: low, moderate, and high. The purpose of the simulation determines the level of fidelity used. Low fidelity incorporates static tools, for example, an injection pad and a syringe to practice IM injections. Moderate fidelity involves the use of more realism, such as breath sounds, but it lacks the automatic cues, such as the rise and fall of the chest, to simulate breathing. High fidelity incorporates a sophisticated computerized mannequin that can mimic a real-life situation. For example, the mannequin's chest will rise and fall. Now, the benefits of simulation are threefold. 1, it offers the opportunity for nursing students to practice skills, techniques, communication, problem solving, and critical thinking in a safe environment. 2, It enables students to critically analyze and reflect on their performance. And 3, it promotes active learning, so what is learned can be retained longer. Now, moulage comes from the French word meaning casting or molding. It is the art of applying mock injuries for the purpose of training, and it's a tool that can be used to help the student look for the physical signs that support the stated diagnosis, recognize new findings, and supports scenario learning objectives. The roles in conducting a scenario include the scenario chief. That is the individual who determines the mannequin controls and the direction the scenario will go. The simulation specialist, that's the individual that operates the mannequin. Various healthcare providers, simulated embedded actors, also called confederates or standardized actors, that can play the role of a family member or a stranger. The standardized actor can even be a distraction within the scenario so that they're able to increase the noise to create a more realistic scene that you would find in the clinical area. Now, to further explain the standardized actor, this is a person trained to consistently portray a patient or other individual in a scripted scenario for the purposes of instruction, practice, or evaluation. The learner roles in simulation are nurses directly caring for the patient. Now, that's an active role. The medication nurse, that is an active role as well, or the recording nurse, and that, of course, is a more passive role. The steps in simulation are pre-briefing, simulated-based learning experience, and debriefing, and we will be learning more about those. Pre-briefing is the information session prior to the start of the simulation-based learning experience, in which preparatory information such as the scenario objectives, roles to be carried out in the scenario, an overview of available equipment, any needed report to set up the patient status is given to the learners. Then you have the simulated-based learning experience. This is a structured activity that allows the participants to develop or enhance knowledge and skills by responding to the realistic situations. Debriefing follows the simulation learning experience, and it's where learners are engaged in discussions regarding reflections of their performance in hopes of transferring learning into future situations. Now, there are some guidelines for the scenario, and the scenario should represent a real-life patient care situation, provide clear connection between course objectives and the scenario, be appropriate for the level of the learner, and promote learner knowledge, skills, and communication ability. Here are a number of resources as we close this particular session. The International Nursing Association for Clinical Simulation and Learning, the National League for Nursing Simulation Innovation Resource Center, and the Quality and Safety Education for Nurses. At that particular site, you can find ready-made simulations that include the cues and competencies. In the National League for Nursing Innovation Resource Center, you will also find some ready-made simulations that you may want to tailor for your use. Thank you for listening.